So let's take a look at our model now. So this is a 30-year-old female. She's quite happy with her lips overall, although she did say she wanted some gentle enhancement of the contour of the upper lip, as well as the lateral aspect of the lower lip on both sides, as well as a bit more volumization projection of particularly the upper lip around the lateral tubercles on both sides, and perhaps a little bit of volumization on the lower part of the lip on both sides, just to achieve a little bit more eversion like so. She also mentioned the corners turning down ever so slightly, so perhaps a little bit of support around here to give a bit more of a positive appearance to the face. And finally, just a little bit of enhancement around the filtral columns, again to give them a bit more projection. So let's take a look at the objective measurements of the face. So when we look at the face, we like to divide it into thirds. So these are the horizontal thirds, and we can see the model has a good harmony and balance in this ratio. We also want to look at the vertical fifths, which are delineated by the width of the eyes. And so when we look at this ratio, the lips should fit in between the medial aspects of both of the irises. So another measurement for lip width is to look at the base of the nose, and that width should correspond to a ratio of 1 to 1.6, represented by the width of the mouth. So again, we have very good balance and proportion in this patient. So now let's take a look at the skeletal classification of the patient, and that's the relationship of the mandible to the maxilla. We can see this is a class 2 classification, and this will have impact on the prominence of the marionettes, chin crease, as well as the protrusion of the lips. So now let's zoom in onto the lips themselves, and let's take a look at the proportion of the upper to the lower lip. In a typical Caucasian lip, we should have a ratio of 1 to 1.6, which this patient does have. Let's take a look at the symmetry of the lips. Again, there's good symmetry on both the upper and the lower lip. Perhaps the corner is a little bit higher on her right side. In terms of dynamics, it's important to assess the lips upon rest, but also on smiling. So if we go into a full smile, and now a gentle smile, and give us a pout. A pout, that's right. Okay, and relax now. So this can be done from the front on, diagonal, and also full lateral. Let's take a look at the upper lip now. So the length of the upper lip should be under 2 centimeters in females. That's from the base of the nose to the bottom of the upper lip. When the mouth is open gently, we should be able to see the upper teeth around 1 to 4 millimeters of tooth show. And we want to look at the tubercle in the middle and also the 2 lateral tubercles on either side of the upper lip. When looking at the lower lip, the length of the lower lip down to the chin should be no more than 4 centimeters in females. Again, when the mouth is open, we shouldn't be seeing too much of the teeth showing through. And finally, we want to assess the 2 tubercles on the lower lip, which are lateral to the midline. Let's also take a look at the adjacent structures to the lips, so the nasolabial folds, the corners which run down to the marionettes, the chin crease, and any presence of perioral lines. We also want to assess the midface, as this has a huge impact on the way we perceive the marionettes, the jowling, the nasolabials, and the overall perioral complex. So now let's take a look at the patient's profile in full lateral. And here we want to assess the nasolabial angle, which should be around 85 to 105 degrees in females. We also want to see the Steiner's line, which connects the columella of the nose down to the pagonian of the chin, and see how far the lips come into contact with that. And finally, let's take a look at the glogocline point, which connects the white lip to the red body of the lip, which is delineated by the vermilion border. And we can see that beautiful ski slope jump right through here. So although it's useful to have these guidelines and assessments, it is important to understand patients' requests and also preserve their natural uniqueness and character in the lips.